Greetings to all of our followers, new and old. My name is Alexis, and I will be presenting this PowerPoint about the respiratory system. Please be sure to subscribe to our YouTube channel and subscribe to our email subscription located www.aimemccs.com. Respiratory system. Respiratory is also known as the pulmonary system, and the purpose of this presentation is to help you study for an exam or just to get a brief overview of the respiratory system. Our objective is to help you, our followers, to get a basic overview of anatomy and its functions of the respiratory system, review of key terms related to the respiratory system, and review of common disease of the respiratory system. What is the respiratory system? Respiratory illness is a common problem in the United States. Many times, people are genetically more likely to get a respiratory condition, but your workplace or environmental exposures could also play a big role. The human respiratory system is a series of organs responsible for taking oxygen and expelling carbon dioxide. Respiratory system includes the nose, nasal cavity, pharynx, larynx, trach, bronchi, and their small branches, lungs, and alveoli. The primary organs of the respiratory systems are lungs, which carry out the exchange of gases as we breathe. As we breathe, oxygen enters the nose or the mouth and passes the sinuses, which are hollow spaces in the skull. The human body needs oxygen to sustain itself, and sinuses help regulate the temperature and humidity of the air we breathe. Risk factors. One thing for sure, smoking is the most common cause of respiratory disease. Other common risk factors include secondhand smoke, the age and genetics of the person, exposure to fumes from burning fuel, and also occupational exposure to dust and chemicals while working. A person with history of childhood respiratory infection can also be at risk. The function of the respiratory system includes the nose, the pharynx, the trach, and the bronchi. The human respiratory system is a series of organs responsible for taking in oxygen and expelling carbon dioxide. The primary organs of the respiratory system are lungs, which carry out this exchange of gases as we breathe. Please take a moment to review some of the medical terminology of the respiratory system. Take notes or jot down some of the medical terminology that's listed. Respiratory system ICD-10. Like most systems, ICD-10 contains a dedicated chapter for the respiratory system. Although relevant codes may be found throughout the ICD-10 book, as always, simply look in the alphabetic index to find the code that you're looking for and then begin to verify in the tabular list in the back of the book. The ICD-10 code categories for Chapter 10, which is the respiratory system, includes disease of the respiratory system, which is J00 through J99. And listed below are all the code categories. Now we're going to speak on the common diseases of the respiratory system. COPD is the most common disease of the pulmonary system, respiratory system. Chronic obstructive pulmonary disease, COPD, is the leading cause of death in the United States with more than 150,000 deaths annually. COPD is the parent description, sidebar. When I state the parent, it just means that it's the primary or it's the general code. COPD is the parent for a group of chronic progressive lung diseases that obstruct the airways in the lungs, making it difficult to breathe. COPD includes chronic bronchitis, asthma, and emphysema. Signs and symptoms of COPD includes chronic cough, shortness of breath, wheezing, chest tightness, and fatigue. To diagnose COPD, most providers use PFT, spirometry, chest x-rays, CT scans, pulse ox, or sputum evaluation. Coding COPD. Chronic obstructive pulmonary disease is applicable to chronic obstructive airway disease, chronic obstructive lung disease. J44.9 is used to describe COPD. COPD classifies to the following categories: J43, emphysema; J44, other chronic obstructive pulmonary disease; J45, which is asthma. There is an exclude to note for lung disease due to external agents. You would use J60 through J70 to use any code for lung disease due to external agents. Always be sure to review the documentation carefully to determine if the condition is an acute exacerbation or if there is an associated lower respiratory infection. Knowledge check. There is a 72-year-old African American male present today with complaints of shortness of breath, postnasal drip, leg pain, and foul urine odor. PFT was ordered and labs were collected: A1C, CMP, CBC, and a TSH. Patient is diagnosed with new onset severe COPD with acute bronchitis, diabetes with polyneuropathy, an EMG was ordered, and hypertension due to CKD3. What are the appropriate codes? Please take a moment to review the case study and choose the appropriate codes. And the appropriate code would be answer C. And here is the rationale for the answer that we chose. Please take a moment to review it. If you have any rebuttals, please post your comments listed below. Emphysema. Emphysema is a type of COPD involving damage to the air sacs in the lungs. As a result, your body does not get the oxygen it needs. Emphysema makes it hard to catch your breath. You may also have chronic cough and have trouble breathing during exercise. The most common cause is cigarette smoking. If you smoke, quitting can help prevent you from getting this disease. If you already have emphysema, not smoking might keep it from getting worse. Treatment is based on whether your symptoms are mild, moderate, or severe. Treatment includes inhalers, oxygen, medication, and sometimes surgery to relieve symptoms and prevent complications. Coding emphysema. J43.9 is used to describe emphysema. It's applicable to bullous emphysema, emphysema not otherwise specified, vascular emphysema, and emphysematous bleb. I hope I said that correctly. If not, please excuse me. We do have some exclude type 1 notes listed below. And we also have used additional codes to identify if the patient was exposed to environmental tobacco smoke, if the patient has a history of tobacco dependence, occupational exposure to environmental tobacco smoke, tobacco dependence, and if the patient is currently using tobacco. Pulmonary fibrosis. Pulmonary fibrosis is a lung disease that occurs when lung tissue becomes damaged and scarred. This thickening stiff tissue makes it more difficult for your lungs to work properly. As pulmonary fibrosis worsens, you become progressively more short out of breath. Coding pulmonary fibrosis. J84.10 is used to describe pulmonary fibrosis. It's applicable to cirrhosis of the lung, fibrosis of the lung, induration of the lung, post-inflammatory pulmonary fibrosis. Now we're going to have another knowledge check. What structure is responsible for moistening, warming, and filtering the inspired airway? Please take a moment to think about this. And the answer is B. And the correct answer is B. Nose. Great job if you answered correctly. Here are our references that we use. Again, we thank you for your time. And as always, thank you for your support with AIM Medical Consultant Services. We truly appreciate you all.